Hello friends, welcome back. In this session we are going to discuss about mercury poisoning and toxicology. Myself Dr. M. Srinivasan from Chettinad Hospital and Research Institute, Chennai. When we tell about mercury, the first thing often comes to our mind is this beautiful planet. That is Mercury, which is the smallest and second hottest planet in the solar system, while Venus is the hottest planet, right? He is a popular rock singer from Britain. He is Freddie Mercury. He has given a lot of very hit albums. This factory, which is producing chemical thermometers using mercury, which was situated in Kodaikanal, has been shut down following allegations of dumping of these mercury waste in the nearby vicinity, due to which many residents fell sick with the poisoning of mercury. Right, these are the victims said to be suffering from various manifestations of chronic mercury poisoning. So due to which out of court this company have given compensation for more than 500 victims who are suffering from this chronic mercury poisoning. Eventually, this factory was shut down. This mercury, that chemical formula Hg, is derived from hydrogyrum, right? It is also called quicksilver or liquid silver or para, because its color is somehow silvery white in color. This metallic, also called elemental mercury, is a heavy silvery liquid which is per se non-toxic. So if the patient inadvertently bites the chemical thermometer and swallows the mercury, it won't get absorbed by our GIT, so it won't produce any toxic manifestations. Right? A simple reassurance is enough, and with a mild laxative, it will generally get excreted in the feces. Whereas that broken thermometer, the glass particles from that may cause some harm or injury to the mouth. Otherwise, per se, metallic mercury is not poisonous, but the vapors that are produced, they are extremely toxic, right? So when the mercury spills in the floor, it is very difficult to scoop up these because they break into small round these globules. Generally, we have to use this hand pump like that, or the syringe. We have to remove these small droplets of mercury which are lying in the floor. Otherwise, it will emit under room temperature toxic vapors. Or we have to put sand over the spilled mercury, then that sand can be removed as it absorbs the mercury particles, right? As I told, this elemental mercury vaporizes at room temperature to give off a toxic fumes, mercuric mercury. It doesn't have any specific odor, so the persons inadvertently get exposed to vapors of this mercury and get poisoned, right? It is extremely toxic while inhaling, but without awareness they will inhale because it doesn't have any specific color as well as any specific odor. This property that metallic mercury and room temperature emits this mercuric mercury was demonstrated by Michael Faraday, who suspended a gold leaf above the beaker containing the mercury, and gradually that gold leaf turns into amalgam as mercury combines with the gold. As far as various derivatives of mercury are concerned, mercury occurs in three forms: elemental form, inorganic form, and organic form. Right. Coming to inorganic salts, again they are divided into mercuric salts as well as mercurous salts. The mercuric salts are bivalent with the formula Hg2 plus. Right. They are more soluble in water, so relatively they are more toxic compared to mercurous salts, which are less soluble in water. Coming to important mercuric salts are mercury chloride, also called a corrosive sublimate, which is the most toxic inorganic salt among the inorganic salts of mercury. Other being the mercuric sulfate, also called cinnabar, which is a main constituent of vermilion or sindoor. The sindoor is used to uh, just to as a mark for the married females. In the potting of the scalp hair, they put this reddish orange colored powder. It is composed of mercuric sulfate as well as another similar orange red powder, that is lead tetroxide, also called red lead, right? This mercury chloride, which is said to be the most toxic inorganic salt, is also called as a corrosive supplement because it is having a corrosive action, causing mild corrosive effect in the mouth and the mucosa of esophagus and the GIT and all. Sublimation means if you heat the solid substance without getting turned to liquid, it directly goes to the vapor form, right? Since this mercury chloride on mild heating is vaporizes instead of going to the middle liquid form, it is called sublimate, right? So corrosive, because of corrosive art, it sublimes, right? Directly converted into vapor on heating. This is also called a corrosive sublimate. Coming to mercurous salts, which are relatively less toxic as they are less soluble in water, they are monovalent, Hg plus, right? So Hg means metallic mercury, Hg plus means monovalent salt, Hg2 plus means bivalent mercuric salts, right? Important compound under mercury salt is the mercurous chloride, also called calomel. Right? Coming to organic mercurials, uh, important compound is the methyl mercury as well as dimethyl mercury, which are said to be the most toxic mercury compounds compared to this inorganic and as well as organic. Most toxic is the methyl mercury as well as dimethyl mercury, right? Mainly it causes a CNS toxicity. This is methane mercury. So this is the mercury chloride, which is a white crystalline powder similar to oxalic acid. This is the mercuric sulfide. As I told, it is also called sindoor or vermilion. Lead tetroxide also it will look similar to this reddish color, also called a red lead. This is the mercurous chloride, which is again a white powder, right? This organic mercury, which is the most toxic, that is methyl mercury, generally it is responsible for scientific poisoning in the people who are consuming fishes being caught in the depth of the ocean, right? Suppose if you are, in case any industrial effluent containing mercury or the smoke containing mercury vapors, they are coming into contact or these effluents enter the ocean, then they are converted by the anaerobic bacteria, that inorganic mercuric compounds, to organic methyl mercury, which is taken up by these planktons, right? Both the phytoplankton and the zooplanktons, which are consumed by smaller fishes, and in the food chain, the smaller fishes being consumed by larger fishes, and if they get caught in the deep ocean like shark or swordfish or shellfish, and whoever eating these deep sea fishes for prolonged years, they are exposed for this methyl mercury toxicity, right? It occurs as a chronic methyl mercury poisoning. Uh, Incidents have occurred, like that's why in the Japan, the Ocean city Minamata, lot of people suffered from this methyl mercury poisoning, right? We will come to that Minamata disease later. This chemist from US who died due to exposure to this dimethyl mercury. In the lab, just as you accidentally spilled 1 or 2 drops of dimethyl mercury over her gloved hands. After 2 or 3 months, she developed a toxicity of this dimethyl mercury and eventually died in the year 1997 at the age of 48 years. Then it was found this dimethyl mercury has the capacity to permeate even the latex gloves, right? And even 1 to 2 drops was sufficient to cause the death of this tiny scientist. That is why it is advised to use a silver shield underneath the impermeable, abrasion-free gloves, right, to avoid permeation of this dimethyl mercury into the skin. Coming to uses of various mercury compounds, it is as we have seen, it is used in this barometer, chemical thermometer, and sphygmomanometer we are using in our clinical setup. These chemical thermometers and these sphygmomanometers, they are generally being phased out because of this chance of toxicity by mercury. They are becoming now digital, though digital are relatively less accurate compared to these chemical thermometers, sphygmomanometers. Then dye cell batteries use this mercury, as well as they contain sodium hydroxide, like that, alkalis also. So the child consumes dye cell batteries, they may get exposed for this toxicity of either sodium hydroxide, which is a corrosive, or these mercury compounds, right? So mercury poisoning may occur if there is a leak of subsequently. If there is no leak, it will be harmless and it will get excreted in the feces. And these mercury vapor lamps or fluorescent lamps, or CFL, that is compact fluorescent lamps, use mercury. So while disposing these lamps, we have to be cautious. They have to be disposed intact and properly sealed covers and all. Otherwise, if they break, they leak this toxic mercury vapor, right? Then they are used in explosives and fireworks. That Paro serpent, right? PHARAOH, Paro serpent, which is while burning produces snake-like form, right? And during Diwali, that contains mercury thiocyanate, right? Then felt hats. In the past, they were, who are using the felt hats, the manufacture of these felt hats, mercury nitrate was used, because of which those workers in the felt hat industry is exposed. That also will come to see these felt hat syndrome later, right? Then mercury vapor lamps. Then in the medicines are used as an antiseptic and disinfectants, and mercury chloride has been used as ointment to treat syphilis in the past. Then dental amalgam, which contains mercury, tin, zinc, like that. Generally, it contains 50% of mercury, which was previously used to fill the caries and all. That dental amalgam, which is silvery white, as you are seeing here. But recent consumption does not cause any toxicity. This mercury amalgams, contrary to the normal belief that it may cause a chronic mercury toxicity. Then mercury salts are often used as diuretics, purgatives, and then the pesticides also. Miscellaneously, it is mercury is a part of a embalming fluid. Then these mercury salts are used in the grey powder, which is used to reveal the latent fingerprints as a grain preservative, as well as in the manufacture of paints also. This is the button battery, which contains mercury. Coming to fatal dose and fatal period, the mercury chloride fatal dose is 1 to 4 grams, or 30 to 50 milligram per kilogram body weight, right? Coming to mercurous chloride, the fatal dose is 1.5 to 2 gram, methyl mercury 10 to 60 milligram per kilogram, then mercury is 10 milligram per meter cube, of which mercury chloride is important. Just 1 to 4 gram is sufficient. Even zero point 0.5 gram is found to have caused death of an adult. That is 500 milligram is sometimes enough. Coming to fatal period for mercury chloride or corrosive sublimate, it is 1 to 4 days. Coming to mechanism of action, these mercuric compounds, on entering into our body, they combine with combine with the sulfate groups of mitochondrial respiratory enzymes. So they inactivate these enzymes and cause a dysfunction of these enzymes by inhibiting the oxidative phosphorylation, right? So that causes apoptosis or cell death, right? So respiratory group of mitochondrial enzymes, they are affected, leading to apoptosis or cell death due to inhibition of this oxidative phosphorylation. So, like other heavy metals, lead, arsenic, the mechanism of action is same here. That is, sulfated groups of enzymes are affected. So, mercury also combines with the phosphoryl, carboxyl, amide groups and resulting in the dysfunctions. Mercury gets deposited in all tissues, therefore, multi-organ failure or toxicity occurs. We divide the clinical features into acute mercury poisoning, which is exam-wise not so important compared to chronic mercury poisoning, which is called hydrogyrism. Coming to acute poisoning due to elemental mercury and inorganic salts, the inhalation of this elemental mercury, that is mercury vapor, that cause a cough, dyspnea, fever, chills, headache, metallic taste, GI distress, etc. Sometimes it can be used for injection also, right? If it is used as an in the injection form, uh, that may cause local abscess and ulceration, right? Which may require excision of the tissue to avoid further damage. Sometimes some may inject IV this metallic mercury also. That may as it can be used either as a form of suicide, or sometimes it is said to be an aphrodisiac, right? This metallic mercury, in that wrong belief, they may inject this mercury into the veins, due, due to which various manifestations like local thrombophlebitis, granuloma, or sometimes pulmonary embolism, this tachypnea, all these will occur, right? Or ARDS may occur like this. If you take X-ray, we can see in the situation that a radiopaque small droplets of this metallic mercury may be found inside the veins near the injection site. So the inhalation, apart from these regular GI features, that will produce Kawasaki disease-like symptoms, also called mucocutaneous lymph node syndrome, with the typical features of conjunctival congestion, fever, red palms and sores, red tongue, typical strawberry tongue as you are seeing here, with a small, you know, similar to intensely reddish and small bumps like this, right? Then skin rash, cervical lymphadenopathy, similar to Kawasaki disease or scarlet fever, seen in the individuals who are chronically exposed to this inhalation of elemental mercury. It may sometimes resemble scarlet fever also, which is as you know, it is caused by the bacteria Streptococcus pyogenes. Whereas Kawasaki disease, the cause is unknown, said to be due to some autoimmune etiology. Coming to ingestion of mercury salts, it will, as I told, that ingestion of this mercury chloride, which is a corrosive sublimate, we can expect mild GI corrosion with symptoms of abdominal pain, vomiting, diarrhea, and shock. Then there may be pulmonary edema, renal failure, urine is pinkish. So it will affect a multi-organ system. Generally, the ingestion causes damage to GIT as well as renal system, whereas inhalation causes more CNS effects as well as GIT effects. Whereas organic mercury, that methyl mercury, that often causes more CNS damage. So this is the Kawasaki disease-like symptoms that due to acute exposure to uh, this mercury vapor, right? Due to inhalation with the conjunctival congestion, strawberry tongue, rashes around the scrotum and all, reddish palms and soles, right? Then this desquamation of the skin in the nails, near the nails, right? Then rash in the vaccination site and perianal rash, etc. Coming to chronic mercury poisoning or hydrargyrism, which is exam wise more important, often comes as an essay question. That is a hydrargyrism. Like a plumbism represents a chronic lead poisoning, arsenicosis or arsenicism, it implies a chronic arsenic poisoning, whereas hydrargyrism implies a chronic mercury poisoning, right? Sources of poisoning leading to chronic toxicity is due to continuous exposure by industrial workers, excess therapeutic use, or recovery from a large dose or prolonged use of uh, mercury ointment as is the treatment in the past for eczema or syphilis conditions. Coming to chronic poisoning, with respect to inhalation of these toxic fumes of mercury, the patient with the insidious onset of general features of GIT like metallic taste in the mouth, weakness, weight loss, then CNS effects like ataxia, irritability, mental depressions, and all. There will be a classic triad of GTN, right? It can be remembered by GTN, that is a gingivostomatitis in the GIT, then mercurial tremors and neuropsychiatric manifestations in the CNS. These mercurial tremors are typically called Danbury tremors, right? So there will be a triad of gingivostomatitis, intentional tremors, then neuropsychiatric manifestations. Let us see one by one this. Coming to gingivostomatitis, patient complaints of gingivitis with inflammation of gums, halitosis, blue-black line on gums similar to Bartonian lines as we have seen in chronic lead poisoning and all. Then there will be increased salivation called dialysum or siluria. Then there will be a typical tremors in those who are chronically exposed, especially in the workers working in manufacture of felt hats or the industries dealing with mercury. They may exhibit these Danbury types of tremor. Danbury is the city. Danbury is the city in the US which is known as the capital of these felt hats. There, those workers working in this manufacture of felt hats, they developed these coarse intentional type of tremors. That's why it is called Danbury tremors, right? So initially the patient comes with complaints of coarse intentional tremors affecting only the hands, interspersed with jerky movements, right? They cannot hold the glass, etc. Then there is no treatment. Then these tremors further progresses to lips, tongue, arms, and legs, resulting in the impairment of fine skilled activities like patient cannot shave himself, cannot write, cannot hold the spoon, cannot eat, like that. Or cannot walk also due to this involvement of cerebellum and all. There will be in coordination occurs with the shakes. So that is called this is advanced condition is called a Hatter shake or Glasgow shake, right? As seen in the Hatter's manufacturing industries as well as those in the glass industries, those blowing the mercury powder into the glass to give color to the glass, which is used for this ornamental purposes and all. So it is called glass blower shakes, right? The colored mercury salts they are blowing into the glass. So initially there will be a coarse intentional tremor progresses to involve the lips, tongue, arms and the legs where fine activities are affected. That condition is called Hatter shake or Glasgow shake. Then further advanced condition is called concussio mercurialis or tetanus mercurialis, where due to severe tremor involving the entire body, no activity, right? No movement and no activity by the person affected is possible. That extreme condition is called concussio mercurialis. So Danbury tremors progressing to Hatter shakes and concussio mercurialis. Coming to neuropsychiatric manifestations, there will be anorexia, emotional instability, fatigue, insomnia, amnesia, anxiety, shyness, timidity, extreme depression, irritability, progressing to delirium with the hallucinations, suicidal melancholia, that means the extreme form of depression with the suicidal tendencies and all, and the patient will be exhibiting this bipolar like disorder with manic depressive psychosis. One side he may be more anxious and excitable, and the other side is immediately he goes for depression with suicidal melancholia, etc. So excitatory like anxiety, hallucinations, delusions will be there. Other side depressive psychosis will be there. So this condition which is affecting both the neurology and the psychiatry, manifestations with the manifestations or neuropsychiatric manifestations. This condition is called mercurial erythism or Mad Hatter disease or Mad Hatter syndrome. This Mad Hatter syndrome is a feature of this mercurial erythism. As I told, it was seen initially in the hat manufacturing industries, right? Those workers. This was influenced in this Lewis Carroll's Alice's Adventures in the Wonderland, where this character, Mad Hatter, who was talking rubbish and nonsense, probably that would have been inspired by this Lewis Carroll to develop this character, right? Those his character mimics of those who suffered this mercurial erythism. Actually, this character is not suffering from any chronic mercury poisoning, but generally we use the term Mad Hatter to denote any eccentric character, eccentric person, right? Then due to inhalation in the eye, that chronic exposure lead to that vapors of mercury that goes via the cornea and gets deposited in the anterior lens capsule, producing a minute punctate opacities in the anterior lens capsule. In the slit lamp examination, these opacities give rise to malt brown reflex from the anterior lens capsule, right? But there is no the diminishing of this visual acuity, right? Visual acuity will be normal. So this is the slit lamp examination showing this malt brown reflex, brown opacities in the anterior lens capsule. Again, you are seeing the anterior lens capsule brown color deposit. That is called a mercurial lentis. But in exposure to organic mercurial, like especially methyl mercury, there will be bilateral visual blurring as well as tunnel vision, because this calcarine area is affected. There will be a tunnel vision, that is a constriction of the visual field in both eyes will be there. Whereas in the inorganic mercury poisoning, both eyes involvement will be there, but there is no effect on visual acuity. Vision will be normal, but the anterior lens capsule in the slit lamp examination will show the brownish deposition of methyl mercury vapor, right? These vapors of mercury. Then there will be inhalation lead to renal damage with mercury ions go and deposit in the proximal convoluted tubules, resulting in the acute tubular necrosis. So membranous glomerulonephritis may occur. Coming to ingestion, there will be qualities melanosis coli with a brown or brownish black deposition in the mucosa of the GLT, dementia, tremor, renal damage with PCT necrosis will be there. Then there will be acrodynia or pink disease or Swift disease. Acro means extremity, dynia means pain. Usually seen in children in the first half of 20th century who use teething powders which contain these mercuric salts like mercury chloride. So they are exposed to chronic toxicity with symptoms of anorexia, insomnia, sweating, skin rash, hands and feet become puffy, pinkish, painful, paresthetic, perspiring, and peeling, with a mnemonic child piece. That is P for pink disease, P for puffy, pink, painful, paresthetic, perspiring, and peeling of epidermis at the terminal stages will be there. From the hands and soles you can easily make out. This is called acrodynia or Swift disease or pink disease. You can see the reddish or pink colored palms and sole as well as that peeling of epidermis at the terminal stages from the both the palms of the patient. In case of ingestion of this mercury or the use of this mercury containing teething powders in the past. All these have been abandoned now. As a beginning of the lecture, I told in case of poisoning with organic mercurials, as I told that industry effluent being let out in the ocean, the fish being poisoned when they are consumed chronically, then that will produce chronic organic mercury, that is a methyl mercury toxicity, which mainly affects the CNS. So initially, periphery is affected with the periphery sensory loss. Then CNS manifestations like tremors, dysarthria, ataxia, muscle weakness, paralysis, hearing and visual loss, and even coma and even death also can have occurred. This, as I told in the city, which is near the ocean in Japan, called that Minamata city. This is a Minamata city now. In the 1950s, a lot of people suffering from this chronic organic mercury toxicity due to prolonged consumption of fish that is poisoned the ocean waters. Then it was later found that ocean water was contaminated with the industrial effluents containing the mercury. So it is called a Minamata disease, also called a Hunter-Russell syndrome. So this is how this bacteria, bacteria converts the inorganic mercury into methane mercury. Then that is absorbed by these planktons, which are eaten by these small and larger fishes. They are contaminated with the organic mercury. When they are caught in the deep sea, like a shark or a shellfish or swordfish, etc., who are chronically consuming that, they get a scientific poisoning with organic mercury. It's called a Hunter-Russell syndrome or Minamata disease. There in the year 2020, a movie was released called Minamata with incidents from this Minamata disease, right? So these are the clinical features of Minamata disease. Coming to management of mercury poisoning, the diagnosis in case of acute ingestion of elemental mercury, the serial X-rays have to be taken as the mercury is radio opaque. That movement along the GIT can be assessed, right, by taking a serial X-rays of abdomen. Then acute mercury toxicity can be assessed by the blood mercury level. Usually it is less than 10 microgram per liter. So if there is more than 35 microgram liter or 24 hours urine sample shows more than 150 microgram of mercury per liter, or by hair analysis using a neuron activation analysis, chronic toxicity of mercury can be assessed, right? Generally, normally it will be less than 10 microgram liter, whereas for urine, normally it is less than 20 microgram liter. If there is more than 35 microgram or the urine, the 24-hour sample more than 150 microgram per liter, it indicates chronic toxicity, right? These blood and urine samples are generally assessed by atomic absorption spectroscopy, whereas hair analysis is, as I told, is done by neutron activation analysis. Then MRI may show cerebellar toxicity, especially in case of organic mercury poisoning, right? That cerebellar atrophy lead to ataxia like that. Whereas post-central gyrus, that atrophy lead to this peripheral neuropathy, or peripheral sensory loss. Coming to treatment, acute poisoning, stomach wash with egg white or milk can be done. It will absorb the mercury, this egg white and all, that forms a mercury albuminate. That also has to be removed by the stomach wash tube. Especially in case of mercury chloride poisoning being a corrosive, with caution, stomach wash has to be done, right? Otherwise, risk of perforation is there. Then demulsions can be used. Then chelations like BAL or DMSA or DMPS are the certain main line of treatment is BAL or DMSA chelating agents only as antidotes. So the milk can be used for stomach wash or egg white. Coming to chronic poisoning treatment, chelation with any one of the following are the drugs of choice. Initially, the BAL or dimercaprol can be tried as it is a relatively easily available. That is a British anti-leucide. It contains two unsaturated SH groups. So it combines with mercuric metal, right? It competes with uh, sulfide groups of mitochondrial enzymes, right? Since it contains two unsaturated SH groups, mercury combines with BAL. So metal chelate complex is formed, which is insoluble and non-toxic. It is excreted in the urine, right? This is the principle of action of these chelating agents. So initially 100 milligram deep IM every 4 hours for 2 days, then reduced to every 6th hourly for 1 day, then every 12th hourly for next 7 days, depending on the prognosis, right? But it is an oil injection, so deep IM and all has to be given, and it is painful, right? It is painful to the patient, that we have to keep in mind. To avoid these painful injections, that DMSA, that dimercaptopropane succinic acid, right? 2,3-dimercaptopropane succinic acid, which are actually, the products, water soluble products of BAL only. That is called as Succimer. If it is available, it can be given. Because advantage is it is given orally. Dose is 10 milligram per kilogram body weight, 3 times a daily for 5 days, then twice daily for next 2 weeks, right? If there is no improvement. Then another analog of BAL water soluble DMPS, either given IV or orally. For IV, 3 to 5 milligram per kilogram body weight every fourth hourly. Then orally 100 milligram 3 times daily for 5 days can be given. That is sold as a Dimavol, as you are seeing here, either in the injection form IV or oral capsules, Dimavol capsules, which are not so easily available here. Then N-acetyl DL penicillamine is said to be very effective for chronic poisoning. That are also not easily available here. With a dose of 3 millimoles per kilogram per day per orally for 5 days have to be given. Then D-penicillamine, that is effective for copper poisoning or Wilson's disease only, commercially called cuprimine. Orally, it is given as a 250 milligram capsules QAD for 10 days, right? But it is not much effective compared to this BAL or DMSA. So this is the dimercaprol with the two unsaturated SH groups, uh, Succimer, DMSA, D-penicillamine, right? Capsules in the form 250 milligram. Then this is the N-acetyl DL penicillamine, right? Coming to medical importance, usually accidental poisoning, formerly due to use of ointment in the treatment of syphilis or eczema or various skin conditions, this chronic toxicity occurred, right, as accidental poisoning. Then industrial exposure, who are working in hat manufacturing industries or mercury industries with chemical thermometer and all manufacturing, accidental poisoning chances are there. Then domestic exposure due to spillage or careless handling of these mercury, exposure to mercury vapors. Then amalgam for dental fillings, those dentists as well as patient are said to be exposed to this mercury poisoning. As I told, recently it has been proved it is not like that. It doesn't cause any harm. Then food poisoning, as due to eating of this contaminated fish with the methane mercury, that could have caused food poisoning, the seen, as you have seen in the Minamata disease. So accidental poisoning is common. Suicidal and homicidal poisoning are rare, right? So these are the various mnemonics to remember this chronic mercury poisoning chemical features like table, Hg mercury, ATM, EC money machine, like that. Then chronic mercury poisoning, these are other mnemonics. You can pause the slides and you can read, right? These are the clinical features of hydrogelism. So with this, I come to the end of this presentation. Thank you. We meet with another topic in the next session. Bye.